Good morning, students. Welcome to one more important topics Inicet Psychiatry session. So we'll just start the class without any delay. We'll just start the session. We'll just discuss a female of age 28 years came with a complaint of nightmares for the past 1 month. Now she said she has a history of accident in which she lost her mother. Now she also said the accident happened something like 8 months before. What is she suffering with? Now these are the classical cases that come to AIIMS OPD. Trust me, these are some of the most classical cases. Even I have observed in some of my days. I have seen some patients in AIIMS that they come with similar. It's not like 90%, it's 100% is same with these type of symptoms only. They have a history of accident, they lost her mother or father or brother or someone which are very much close to them, and it has happened something like 1 year or 8 months before, and they say like they are having some sort of nightmares these days. So what is she suffering with? So actually you might get an options, like you will be given with some sort of options like she is having an acute stress disorder, or she is having an adjustment disorder, or she is having PTSD, or she is having OCD. Now what's your answer? Now ASD is something whose duration is less than 1 month. The duration of the symptoms is less than 1 month condition. And AD, that is adjustment disorder. Adjustment disorder is something, this disorder starts within 3 months of occurrence of that particular life event. For example, it is accident. Here. So this adjustment disorder, this disorder is observed 3 months within the occurrence of life event. And the duration of this disorder can last up to 6 months. 6 months duration. Now if you come to PTSD, the life event has occurred before 6 months and the symptoms are observed after 6 months of occurrence of life event. And OCD is something which doesn't match even for the question, so we don't need this option, so leave it off. Now adjustment disorder symptoms is less than 1 month, and obviously you don't have that much of scenario. All this scenario will not be in acute stress disorder, so this is not the option. Now adjustment disorder is something which the symptom starts within 3 months of the occurrence of the life event, but here the event occurred 8 months before, so adjustment disorder is also not an option. So the answer is post-traumatic stress disorder. It's as simple as like, why you doctors get confused, I don't know. So many doctors marked it as acute stress disorder. How it will become acute stress disorder? See, the event has occurred 8 months before. Will it become acute? No. And the duration is more than 1 month. She is having from the past 1 month. That implies even tomorrow also she will get the nightmares. Even day after tomorrow also she will get the nightmares. So obviously it is more than 1 month. So acute stress disorder is not an option. Remember, PTSD is the option, post traumatic stress disorder. But if you have any doubt, let us discuss some of the stress disorders, right? Let us discuss the complete topic within a nutshell. Okay, we will discuss right now. So we will discuss the stress and trauma disorders. This is very important, favorite topic of AIMS faculties. This is one of the most fan favorites. Even I am favorite of this topic, trust me. Now, there are three conditions in stress trauma disorders. One is stress, two is burnout, and three is the life event which has actually happened. Right? So, in case of stress, there is a test. There will be a history of test of resources or skills sets. Now, what is meant by there is a history of test of resources or skill sets? Simply exams. One word you can understand everything. For example, most of the students, they will have exams at the final stand of their years, final point of their years. So when they approach the exams, the main thing that they have is stress. Do they have PTSD? No, they have stress, ultimate stress, right? So that is called test of resources or skill sets. They will have in a history, and sometimes there will also be a forces, a reaction or response. The patient forces a reaction or a response, right? See, I think this statement is not needed that much important. The only thing that is important is this one. And third one is based on the intensity, duration and nature. It is divided into, it can be classified as normal or abnormal. So for example, most of the people, if they approach the examinations, obviously they will have stress, which is normal. But if you feel stress for unnecessary things, then it can be defined as abnormal. So the normal and abnormal can be easily be identified by just checking the intensity and the duration and the nature of stress the patient has. If the intensity is too much, which is actually not needed, then it can be defined as an abnormal stress. If the duration of stress is not that much needed for that particular resource, for example, you had an exam today, right? But if you feel stress regarding that exam for the next 1 month, then it is an abnormal stress. If you have exam today, if you have stress today, that is normal. But if you have exam today, you already finished it, but you have stress on tomorrow, then it is an abnormal stress. Why you should have stress? Your exam already finished, so you should be relaxed right now. But still you are feeling stressed. Why? Then it is an abnormal stress. So that is what called based on the intensity, duration and nature, you can just predict that whether that stress is, which is the patient is suffering, is a normal stress or an abnormal stress, right? Now coming to the burnout, what is meant by burnout? Burnout, I think in your normal terms also, after you work for nearly 1 day, 2 days continuously, 24 hours continuously, generally seen in software industries, they completely burn out. They burn out. Something which you can just say that complete whole term in 3 words. One is detachment, and second one is ineffectiveness, third one is dying or exhaustion. Right? I will tell you in simple terms. For example, you will work 48 hours straight. You will studied for 48 hours straight. You will studied for 48 hours. Then after some point of time, you feel like you are completely detached from the original component itself. You are completely detached from the reality. It's like that, because you will work straight for 48 hours. You work straight for 48 hours. Then obviously you feel like that. And after working for 48 hours, your effectiveness slowly decreases. Obviously it's not decreased, it's completely collapsed. There will not be any effectiveness remain in your work. Your effectiveness completely decreases. That is ineffectiveness. And first one is detachment. And another thing is, you can't do work not even for 1 hour. You can't do work not even for 1 more hour, or at least 30 minutes also. That is called exhaustion. So burnout means you can simply predefine it in 3 words: detachment, ineffectiveness and exhaustion. Now coming to the another one is life event. What is life event? Life event is something which changes the course of life. What is the dangerous life event which takes place in the life of a man? Marriage. Marriage is something which is a dangerous life event which completely changes the course of a life of a man. But woman, she feels happy. She get money, she get pleasure, she get money, she get respect, she get kids, everything she gets. But who loses everything? Man. Man loses everything. Man loses his potency, man loses his pleasure, man loses his freedom, man loses his money, everything man loses. So marriage is the life event which takes place in the life of a man, which changes the complete course of his life. Next, life event is something which needs a causative factor. Causative factor. Now what do you mean by this? What do you mean by this? I will tell you one thing. Okay, what do you mean by this? For example, after marriage, what you will have? No, I am not asking about first night. Not that one. After marriage, some years after marriage, something like 5 years after marriage, what you will have? Can anyone tell? Yes, we will have something called post-traumatic stress disorder. We will have trauma, severe trauma in our life. Which make us remember this marriage as one of the dangerous life event which we have come through in our life. So we have post-traumatic stress disorder, right? See, I'm kidding, right? Don't think otherwise. Why? Because most of the girls also listen this classes, so don't think otherwise, right? I'm just joking. Just let's see, life is all about fun, man. Life is all about fun. Okay, so you have a severe trauma, right? Your wife just pulls your hair, she pulls your shirt, she pulls your buttons of your shirt, she shows all her psychoism in front of you. So obviously you suffer with severe trauma and it will remain forever and ever. It's post-traumatic stress disorder. The PTSD that is seen in a husband is a lifelong PTSD. Don't have any treatment. The only treatment is, I shouldn't say that, and I don't want to say it even, right? Because it will become a censor. So obviously the PTSD in a husband is a lifelong PTSD. Okay. So it needs, so which event can be defined as a life event? Something which has a causative factor, right? So what are those causative factors, right? What are those causative factors? Something which causes grief reaction. Guys, these are very important. Just remember this: grief reaction, then adjustment disorder, then something called acute stress disorder, something called acute stress disorder. Then you have fourth one, that is PTSD, post traumatic stress disorder. So life events can be notified, that means a particular event can be denoted as a life event if there causes a particular causative factor. For example, if it leads to post traumatic stress disorder, or it has led to something like adjustment disorder or acute stress disorder or grief reaction. So there should be a causative factor. What will marriage leads to? PTSD. Marriage leads to PTSD, post traumatic stress disorder. It causes severe trauma. You can't even explain what the trauma will be. If she is a good wife, she is a caring wife, not beauty. Beauty doesn't, see, you will enjoy your beauty only for a couple of time, your physical beauty. But if you ask me, the real beauty which is inside means not inside the clothes, I am saying inside your heart, that beauty stays forever until ashes. Until you turn into ashes, that beauty stays with you. So that beauty you should desire for. You should desire for that type of beauty. But if you simply desire for only outside beauty, the skin tone, the height, and all the other things, I shouldn't speak. It's waste of time. Okay, leave it off. We don't want to go out of this. So we will discuss all these factors right now: grief reaction, adjustment disorder, acute stress disorder, and post traumatic stress disorder. Very important MCQ you will be getting in your next exams, right? So first one is grief reaction. What is a grief reaction, right? So there are actually different stages in a grief reaction. A grief reaction consists of different stages. With the mnemonic you can easily remember. What is that mnemonic? Very famous mnemonic. Da. First one is denial. No, my wife did not cheat on me. You simply deny the words of your friends. Your friend said that, "Arey yaar, your wife has cheated you. Wife has cheated you. How I seen your wife roaming on the roads with some other person yesterday evening 4 o'clock. Then you said like, no, my wife will not cheat me. It is completely false and you are telling lies." He simply said. So it is denial. After that you get anger. Arey, what are you speaking? Are you mad or not? Are you mad or what? My wife is not my wife doesn't have such a character. She has a good character. She is a good girl. She won't do such a sort of things. So you simply get anger. After that, bargaining. What is meant by bargaining? Sorry, your wife says sorry. Really, I have done some sort of wrong thing. Yes, the thing which your friend said is true. So I just meddle with some sort of a guy. So I cheated on you, she said. Then what you will do? You will bargain her. Still she says, no, I won't be with you. He has so many money, I will go with him. But still you bargain. No, money will not stay forever. I am the one who will stay with you forever. So don't go after money, right? Love is obviously the outermost thing. Don't go for money. But still she wants to go with. So you go into depression slowly. Finally, you accept. What you accept? She is a bitch. Right? Finally, you accept she is a bitch and you just simply ditch her. If she is a bitch, you ditch her. As simple as like, see, if a woman doesn't love her husband these days, she is simply ditching her husband. Then why you shouldn't do that? Why you shouldn't do that? You simply ditch her. You simply ditch her. If she done the same thing, you simply ditch her. If she is a bitch, you ditch her. As every time one of the best singers says that. One of the best singer, I think I forgot the name of that singer. One very beautiful line I will write here. Guys, a very beautiful line. Chase a chick, never chase a bitch. Very beautiful line. Chase a chick, never chase a bitch. Right? Chase a chick, never chase a bitch. Right? That's one of the beautiful line I have seen in that song. I just heard it. Very beautiful line. Chase a chick, never chase a bitch. Right? So okay. So finally you go for acceptance. So that is the stages of grief reaction: denial, anger, bargaining, depression, and acceptance. DABDA. Okay. Now there is another form of grief reaction called pathological grief reaction. How can you define a pathological grief reaction? Actually, there are different types of pathological grief reaction, right? Different types, and they can be recognized with particular features. They just exhibit with particular features. First one is absent grief. See, I am writing in shortcut form. Don't just confuse. You can, if you have any confusion, you just repeat the video once again, or just go backward 2-3 seconds and you just listen to the word once again. Absent grief means no reaction. And second one is hypertrophic grief means too much reaction. Chronic grief. What is that? Chronic grief means persistence of grief, means the patient express his grief for more than 6 months. Persistence of grief for more than 6 months, if it is in case of ICD, according to ICD, or according to DSM, it is more than 1 year. See, remember, you check the question carefully. If it is asking for ICD, it is for more than 6 months, but if it is indicated with DSM, it is for more than 1 year. That is chronic grief. Now it is something like traumatic grief. That is also called traumatic grief. One more type of traumatic grief. What is meant by traumatic grief? Traumatic grief is simply hypertrophic grief plus chronic grief. You simply see both of these types of grief in the patient. That is called traumatic grief. Delayed grief. What is delayed grief? Delayed grief means the reaction in the patient is seen after 2 weeks. Okay. Now the final type of grief is, there is one more type of grief called anniversary grief. What is anniversary grief? Anniversary grief means, for example, you married a woman, you got to know she is a bitch, and finally you ditch her. So for every marriage anniversary, you remember her. So remember that person on every anniversary of an event. For example, every time you celebrate your birthday, it remembers her. So that is called anniversary grief. You got the example? See why I am telling examples. Don't think otherwise. Don't think Sir is telling negatively. No, I just want to tell these things, but so that you can remember easily. Nothing much. That's it. I have that simple thought, like if I tell with the help of examples, you can remember it. But always remember, boys are the most truthful lovers or husbands than the wife. That's a fact according to the science only. Science itself, census itself speaks. Even the statistics speak the same thing. boys are the most truthful lovers or husband more than girls, more than girls. That's a fact which I'm not telling it. This is the fact that is explained by statistics as well as the science also speaks the same thing. You know one thing, one MCQ, girls commit suicide more than boys. The stats of committing suicide of the girls is more than boys. The statistics is more than boys. But successful suicide means death rate or the successful suicides are committed by boys more than girls. Means the girls, if they commit suicide, 99% they won't die. They just only commit suicide to make the other or opposite person fear, to just instill fear in them and to achieve what they want to achieve, or to make the other person do what they really want to do. But boys, they are not such a human beings. Boys, they might be having a stone heart. They might have a stone heart, but that stone is always same in every molecular aspect. You see every part of it, it's just stone. It can be a stone, but still you see every part of it, it's just stone only. But girls, it's different. It's like earth. It is layers, different layers. After as the time goes on, one each layer gets open and different character comes out. So boys always do or commit successful suicides more than girl. This is actually an MCQ. Remember, it's even given in our psychiatry also. Okay. So I think we discussed some of the types of pathological grief. Now we will discuss what are some other life events. Something called, now this is important, acute stress disorder, adjustment disorder, and life events, or not life events, it's post traumatic stress disorder, that is PTSD. Now these are very important, students. Doctors, please listen carefully. You will get one MCQ sure shot, that's my guarantee. Okay. Now first and foremost thing that you should remember, very important, because in most of the times the MCQ consists of this factor. In the MCQ they will give the duration. So what is the duration? Acute stress disorder duration is less than 1 month. Adjustment disorder is, it starts within 3 months of occurrence of life event. 3 months of occurrence of life event, and it lasts up to maximum of 6 months. Now if you come to PTSD, the life event has occurred 6 months before. Life event has occurred something like 6 months before, right? It has occurred something like 6 months before, and after 6 months you are seeing the post traumatic stress disorder. You are seeing different features. After 6 months you are seeing different clinical symptoms in the patient, and which stays in the patient for more than or equal to 4 weeks, right? That is called PTSD. Now what are some clinical features, some symptoms that you see in these 3 types of patients? In case of acute stress disorder, there will be a stress reaction. What does the stress reaction consist of? There will be an increased autonomic activity. Right? And what will you see even more? There will be increased vigilance. Okay. Now in case of adjustment disorder, there will be, the patient will have mild depression. Remember, mild depression, not major, mild depression and anxiety. As well, they have something called conductive behaviors. They have something called conduct behaviors. Conduct behaviors. Conduct behavior means, can anyone tell what is meant by conduct behaviors? Telling lies, stealing, all these are called conduct behaviors. And also, it is also known as situational depression. It is also known as situational depression. Situational depression, very important. Sometimes in your MCQ you might get situational depression as the option instead of adjustment disorder, so you check carefully. Now coming to the PTSD, what are some of the clinical symptoms that we see? They complain of hyperarousal. For every half an hour they get up from the sleep. They have nightmares, flashbacks, and even they show some avoidance behavior. Now this is all about acute stress disorder, adjustment disorder and post-traumatic stress disorder. Now if you ask me what is meant by complex PTSD, sir, in the previous class you said what is meant by complex PTSD. Complex PTSD means which is seen in continuous or repetitive trauma. Nothing but it is just a chronic type PTSD, means there is a continuous or there can be a repetition of the trauma again and again. The trauma is being repeated, the factor or the trauma that is causing it gets repeated again and again. Now you might ask me what are the features that we see in complex PTSD. In complex PTSD, we just simply observe that the patient has a negative like self concept. He himself gets degraded. He degrades himself. So he will get a negative like self concept. He himself makes a concept negatively. And he also present with interpersonal issues. Obviously you will be having emotional dysregulation. It's a common thing. You obviously present with emotional dysregulation. Now someone asked me, sir, what is the graphical representation of acute stress disorder, adjustment disorder and PTSD? Because previously in one of the examination this graph was asked, and you know one thing, most of the doctors has simply marked it absent. Sir, please explain or please show us the graphical representation of a PTSD, adjustment disorder and acute stress disorder. For example, this is the life event. You just see, this is the life event. Okay, and this is 1 month after life event. And this is 6 months after life event. Now in case of acute stress disorder, you simply, the event occurred, your stress simply rises for some days, and after some weeks, 2 to 3 weeks, it again comes to normal position within 1 month. That means the duration of the acute stress disorder is less than 1 month. The duration of acute stress disorder is less than 1 month. Okay. Now if it is in case of adjustment disorder, what happens is the life event occurs, slowly the patient lands up in depression, and at one point of time he understands the situation, and slowly the depression gets decreased, and at about 6 months he just comes to a normal state. He just comes to a normal state. So the so-called duration of adjustment disorder, the duration of adjustment disorder is less than 6 months, less than 6 months, but it stays for 6 months. Okay. Now finally, if you come to PTSD, post traumatic stress disorder, the event occurs and the so-called stress increases, and at one point of time it gets stabilized and the stress continues to become a problem for the patient. The stress continues to remain in the life of the patient. The life event or the trauma which has caused it just remain for more than 6 months. So the duration of PTSD, post traumatic stress disorder, is more than 6 months. Remember that. Okay, just please be on the line. I will just come after 1 minute. Just please be on the line.